What if we told you that a sugar pill could cure your pain, lower your blood pressure, and even improve your physical performance? No active ingredients. No chemicals. No medicine at all. Just a pill made of nothing, and yet your body responds as if it received real treatment. This sounds impossible, but it is one of the most well-documented facts in all of medical science. It is called the placebo effect, and it proves that your mind has far more power over your body than you ever imagined. The placebo effect occurs when a person experiences a real improvement in their condition after receiving a treatment that has no active medical properties. The treatment could be a sugar pill, a saline injection, or even a fake surgery. What makes the improvement happen is not the treatment itself but the patient's belief that they are receiving something effective. The expectation of healing triggers real biological changes in the body, including the release of pain-killing endorphins, changes in brain activity, and measurable improvements in symptoms. This is not speculation. It is documented in thousands of clinical trials. In fact, the placebo effect is so powerful and consistent that every new drug must prove it works better than a placebo before it can be approved. Think about that for a moment. The fake treatment is so effective that real medicine has to beat it in a contest. In many studies, placebos relieve pain in 30 to 40% of participants. In some conditions, like depression, the placebo effect accounts for a huge portion of the response to antidepressants. The pills help, but much of the help comes from the belief that they will help. One of the most dramatic examples of the placebo effect comes from a study on knee surgery for osteoarthritis. Patients were divided into two groups. One group received actual surgery. The other group was given fake surgery. They were wheeled into the operating room, given anesthesia, and the surgeon went through all the motions of the procedure, including making incisions, but did not actually perform the surgery. The results were stunning. Both groups improved equally. The patients who received the fake surgery reported the same pain relief and the same improvement in mobility as those who had the real operation. Their belief that they had been treated was enough to produce real healing. But the placebo effect has a darker cousin called the nocebo effect. If believing you will get better can make you better, then believing you will get worse can make you worse. In one disturbing study, patients were given a chemotherapy drug and told it might cause hair loss. 30% of them lost their hair. But another group was given a harmless sugar pill and told the same thing. They also lost their hair. The expectation alone was enough to trigger the physical reaction. The nocebo effect has been documented in cases of allergic reactions, side effects, and even death. In one famous case, a man attempted to end his life by swallowing a bottle of pills he believed were lethal. He collapsed and nearly died. The pills were completely harmless. His belief alone nearly killed him. What makes the placebo effect even more fascinating is that it is getting stronger over time. Studies show that the placebo response in clinical trials has been increasing steadily since the 1980s. Researchers believe this is because people's expectations of medicine have grown. We see more drug advertisements, hear more stories about miracle cures, and have more faith in medical technology. The stronger our belief in treatment, the stronger the placebo effect becomes. In the United States, where direct-to-consumer drug advertising is legal, the placebo effect in drug trials is significantly higher than in countries where such advertising is banned. The placebo effect does not just work with pills. It works with rituals, environments, and authority figures. A placebo injection works better than a placebo pill. A placebo from a doctor in a white coat works better than one from a computer. A more expensive placebo works better than a cheaper one. A placebo that tastes bitter works better than one that tastes sweet. The more impressive the treatment appears, the stronger the healing response. Your brain is not just responding to the chemical. It is responding to the entire theater of medicine. Even open-label placebos work. These are placebos that patients know are placebos. In studies at Harvard, patients with irritable bowel syndrome were given sugar pills and told explicitly that they contained no active ingredients, but that the placebo effect had been shown to help. They still improved significantly compared to a group that received no treatment at all. The conscious knowledge that it was a placebo did not eliminate the effect. This suggests that the healing response can be triggered by the act of receiving care itself, not just by deception. So, what does this mean for you? It means that your expectations shape your reality in a very literal, biological way. If you expect a treatment to work, your body mobilizes resources to make it work. If you expect to fail, your body complies. This is not positive thinking or wishful magic. It is a measurable, replicable medical phenomenon. The practical takeaway is simple. Surround yourself with beliefs, environments, and people that support healing and improvement. Take treatment seriously, whether it is medicine, therapy, or exercise, and approach it with genuine expectation of benefit. Your brain is listening to everything you believe, and it has the power to make those beliefs physically real. The placebo effect is not a trick. It is a window into the most powerful pharmacy on earth, the one inside your own mind. What belief are you holding right now that is shaping your reality?